All right. Well, welcome everybody. Again, here today we are covering a introduction. Really, will be in PowerPoint this whole time, introducing, discussing through the basic statistics as it pertains to ARM, primarily. I can't claim to be an expert of anything outside of the realm of ARM, of course, but we try to put together kind of a discussion on the things we see the most, either in questions and support or just in the industry as a whole when we're out training groups and things like that. What is at least kind of the very basics of getting through what to do once you recorded your data, and how that pertains statistically, analysis wise. And so, as I said, today's really part one of 4 parts, and we're covering really everything, the theory of it, and then in our next sessions, we will be in ARM showing each of those steps and all the tools that we have in our software for the analysis and the steps leading up to the analysis. So today, specifically, we're going to be covering analysis of variance, mean comparison tests, and the assumptions of AOV that we need to watch out for. All right, the goal of research is often to determine whether your treatments of interest perform differently. The choice of your treatments could be different products, different formulations, or different rates of application. We want to know if those treatments can be distinguished from one another in their effectiveness, safety to the crop, or cost. Sometimes maybe you're hoping that the performance is indistinguishable if your product's cheaper. So research trials are then performed to obtain observations of treatment performance. We call those assessments or ratings, typically in ARM. But the question is, are the observed differences due to the treatments, excuse me, or due to random chance? If we could test in every field across the world, we'd have a definitive answer. Of course, that's not possible. So statistics are used to provide an idea of how confident we can be in conclusions drawn from the results. Oops, missed my cue here. All right. However, you really should not immediately jump to the analysis after you put in your data. The data confirmation is important to catch outliers and inaccuracies with the data before analysis occurs. Best way to ensure accuracy is by reviewing the assessment immediately afterwards while you're still at the trial site. This way, any irregular values can be investigated and resolved. If you wait to input and review the data back in the office, these irregularities can only be ignored in the analysis, causing a loss in statistical power. The issues we are looking for sometimes just be a typo from data entry, or it could be an outlier, which is an observation outside your normal or expected distribution. Another trick for data accuracy would be just to identify an acceptable range of values before you take the assessment. That way, extreme values would really stand out during note-taking, cutting down on surprises at the end review. And we will, have this whole phase here, this data confirmation step. That'll be next week's session, data confirmation. So we'll learn all about the tools in ARM for this process in the next session. All right, so to set the stage, let's just kind of take a first glance at the end goal that we have, which will be the analysis of variance, or AOV for short. So statistical variance is a measure of how spread out the data is about its mean. The goal of AOV is to dissect the variability in the recorded assessments, to understand whether the differences we've observed between treatments is due to the treatments themselves or just by random chance. There is controlled variability that the researcher had a hand in from the treatment and the blocking structure. Then everything that we cannot control is called the experimental error. So the overall approach is to consider that the observed response really kind of has three components. You have the baseline response, as if nothing had occurred in the trial, the effect that the treatments and the blocking specifically had, and the effect of the random influences too. In order to draw conclusions about the treatment effects, we want to estimate what the random or uncontrolled effects are. To do this, we're going to need to make some assumptions about their behavior. So these assumptions are quite important because if they're not met, then the results of our analysis can be relied upon. It really forms the foundation for what we can guess about those errors. So if we don't meet these requirements, if you will, these assumptions, then our analysis might not tell us anything, or could tell us the totally wrong thing. We can't trust what the analysis gives us in the end. So this really becomes a key focus of ours in data review as we prepare for the analysis itself. So let's take a closer look at these assumptions. The first one is homogeneity of variance. And that is that the variances of the different treatments are approximately equal. If you have a treatment that is much more variable or much less variable than the others, the analysis will not work. So to determine if this is the case, we could look at a box-whisker graph and run a statistical test for homogeneity of variance. The Levine's test is generally chosen, but we also have Bartlett's available in ARM too. The next assumption is that the distribution of errors is normal or bell-shaped. We have this in equal variances, then the math can do its thing because we can calculate a reasonable guess for the amount of error based on that standard bell-shaped curve. So tests for this include skewness, kurtosis, and Shapiro-Wilks. Another assumption is additivity of effects, specifically of the treatment and block effects in the typical RCB design. For example, the effects of treatments such as an insecticide are likely to be multiplicative on the population count, affecting a proportion of the insect population. So perhaps the most suitable assessment to analyze would be a percent of untreated calculation instead of raw counts to gauge the efficacy. So don't really have a specific statistical test with this one. a little bit different than those first two. And then this last one is in a similar boat. The last one here is independence of errors, that that one assessment does not directly impact the next or previous value. Again, kind of hard to test for, but the important thing is really to not introduce bias in the assessment. Things like edge effects or subjective ratings being influenced, things like that. So the assessment map, the heat map, might be useful to detect some of those types of issues, which we'll see in the data confirmation step. Actually, we'll get to use that tool. All right, so what happens if these assumptions are not met? Well, we cannot rely on the results unless we take an alternative action. So there are data correction transformations that are designed to correct the underlying distribution of the data, and thus the errors, without affecting the results. And so we've got the kind of the three main ones here. The logarithm transformation is used with counts of things that occur in clusters, as that's usually a log normal distribution. The square root transformation is for counts of things that occur at random, or a rare occurrence, and that it usually is a Poisson distribution. And then the third one is arcsine square root percent, and that works with proper percentages that often follow a binomial distribution. Spatial models try to recover information about hidden variables across the field. We have 3 trend and 4 nearest neighbor models that can be used in ARM. This is commonly used when the blocking design fails, or when blocking is just not a realistic option. Finally, non-parametric statistics. They throw out ANOVA and its assumptions, and instead just analyze the data by ranking the assessment values. A mean comparison test can still be run on the mean of those ranks. So we'll see in the data review portion, when we do an example of that, it's kind of nice because it fits right into our usual ARM report. We don't have to generate a totally separate document for running some of these statistics. It'll fit right into the structure already, even though the underlying statistics being run will be different. And we'll kind of see how that plays out in our later session. So this kind of encapsulates these assumptions and testing for it and fixing them. That really encapsulates the data review step portion, which is our second, I guess it'd be our third session, if you count today as the first one. The third session here, all about data review, which will be tied pretty much exclusively to the column diagnostics tool that we have in ARM. All right. So moving on, after we've reviewed the data, then we're ready to proceed with the analysis. So I've got an example AOV output here, just from a dummy trial with 5 treatments and 4 replicates. And we'll just kind of step through each of these calculations. So the first column here, the degrees of freedom, It's a bit tricky to define, but it's the number of values in a final calculation that are free to vary. So with variance, the degrees of freedom equals n minus 1. So for our 5 treatments in our study, that means we have 4 degrees of freedom for treatments there. And with 4 replicates, we've got those 3 degrees of freedom. Next is the sum of squares. So that's the amount of variation in the data, split up into each source listed in the table. So we're taking, in our case with RCB, we've got a replicate affect the treatments, and then everything that's left over, that error. So we've got 3 different values there. Then the mean square, that is the sum of squares divided by the degrees of freedom. So we're really taking the amount of variation and dividing it by the degree to which it can occur. Then we calculate an F ratio, which indicates the level of variation from that source compared to the random variation. So we're taking the mean square or the rep, divide that by the error to give us this F ratio. And then the same thing for the treatments. And so the larger that ratio is, the more likely that the variance from that source is not due to just random chance. There's so much more variability that can be attributed to that compared to what we can attribute in the error. And that would give us more of that confidence, if you will. So to kind of quantify, though, what is strong, or how high do we really care about, we calculate a p-value, which is the probability that the observed differences in treatment or block means could have arisen by chance. So a low p-value, typically the cutoff, it oftentimes is 5%, indicates that we can be confident that there are real differences among treatments. And that's what we have here, 0.04. Whereas with our blocks, this is a high p-value. So that would really indicate that there is no evidence of a real difference among blocks in this case. It could be because there is no real difference, or that the differences are just too small for us to detect. All right, so to summarize, the AOV analysis breaks apart the variance of our observations into sources and then calculates a p-value as its end result. Remember, the p-value is a probability. The AOV p-value is the probability that no differences in treatments exist. So a p-value of 0.04 means that we are 96% confident that there are significant differences between treatments. But we are not done yet. We need to know which observed differences between treatments are significant and which are not. And so the AOV analysis does not provide an answer about which observed differences are significant, just whether there's evidence that a significant difference does exist somewhere in your list. So the next step of the analysis is to run a mean comparison test. Also called a mean separation test. We compare the treatment means to determine what differences are truly significant. ARM has a variety of mean comparison tests to choose from for different situations and research types. So these four are the most common ones: LSD, Duncan's new MRT, student Newman QLs, and Tukey's HSD. We must also choose a significance level, or alpha, to run these tests. This is similar to the p-value for confidence in the AOV results, but it really is setting the threshold for significant differences for the test. Thus, an alpha of 0.05 implies that we only accept differences that have a probability of 95% or higher of being true. Fairly important to make the selection of your alpha level prior to running any analysis, as the choice really should not be biased by your desired outcomes. Looking at the report, oh, I didn't get significance, let me just go and change my alpha until I get to see significance. Really isn't really isn't a good practice. So I see a question here, and I think we'll see if we tackle it here in this next slide. But if not, we can cycle back. What should we choose here between those two options? There's a lot of combinations we can run. So looking at the mean comparison tests, you can classify them by how liberal or conservative the test itself is. This means that a test can be more likely to report a false positive, or a type 1 error, or a false negative, a type 2 error, respectively. So the first, those four tests in ARM that we mentioned, there's a few other ones as well, but those first four are arranged specifically in the list from most liberal down to the most conservative. So LSD is first. That's kind of the most liberal test. It's the one most likely to report differences. So you're most likely to see differences, but it suffers from a higher false positive rate. While you can be most confident in the differences that the conservative Tukey's HSD reports, even though separation is less likely to be found. So, when deciding which one to use, probably the first choice would just be to follow any industry or discipline standards. Is a good way to start. So if if everyone in this industry runs Tukey's, or seems like everything published is running SNK, that might be a good choice, a good starting point. Or if you're doing contracted research, the study sponsor might request a specific test and an alpha level. Then that's very simple. We'll just follow their guidelines and what they want to see being run. The purpose of the study should also be considered. So if your trial is being used for registration, then a conservative test would maybe be more appropriate. You don't want a false positive. You want that real great confidence that you're not you're not mischaracterizing the differences. However, if you're doing a screening trial, that's all about potential. And so a more liberal test would maybe be preferred in that case, because any false positives would just get weeded out in future studies. You're just looking for the maybes, the potential of things. So you could be much more liberal in that case. Finally, you consider the penalty of failure of the treatments. So for example, the failure of a crop protection product will likely have a real impact on yield. And so an alpha level of that 5% is very common. But for a biological product, just for plant health, the penalty of failure is just the cost of the product. And you maybe, you wouldn't realize the gains in yield that you were hoping to see, but it's not going to negatively impact what should have happened, even if you didn't apply the product. So you really have a much lower penalty of failure for something like that. So that's why ARM has all the different significance level options that go larger and larger, because a 15-20% significance level can be perfectly acceptable in those scenarios, because it's just a matter of balancing that out. And in a case like that, you don't need to have such confidence. That significance level can be higher. All right, so hopefully that kind of helped with that question. I'm not in the industry enough to rattle off some of the examples you gave: count of dead insects, fungal disease severity. I don't know off the top of my head with some of those kind of what would be the industry standard, or discipline standard, I guess, in these cases. If there are some out there, or if it's just a little more of a local thing. But hopefully this just kind of gives you some ideas of how to balance it. Definitely kind of a lot of tidbits all go into that choice. So it's hard to make it real cut and dried of, hey, always use this one or usually use this one. It's fairly complicated in some regards. All right, so let's walk through an example of how a mean comparison test works. The specifics are of course a little different for each test in how things are calculated or done, but the basic concepts are the same. So I think this is still informative to go through. So first step is to calculate a test statistic to perform the comparison of means. So in this example, we will use the LSD at a 5% significance level, and just kind of using that data that we had looked at before. And it turns out the calculation ends up being 5.49 for this data. Then we compare the largest treatment mean to each of the other means using that test statistic. If the difference between means is smaller than the LSD value, then they are not considered significantly different. So I like to imagine it kind of as a ruler. The LSD test statistic is kind of our ruler, and we hold it up to each pair of treatments to decide if the difference between them is large enough or not. To try to maybe visualize this better here on the screen, we can use a number line. So I've got the number line here. I've just plotted out each of those red dots, each treatment mean here. And this LSD value or test statistic creates a range around each mean. And anything outside that range is significantly different according to that mean comparison test. So let's start with the largest mean and extend to the lower bound. All treatments within this range are not significantly different, so we assign the letter A to treatments 5, 1, and 4. And then we repeat this process for each mean. Because there are no new means in this next range, we don't need a letter here. The next range does include treatment 2. And so treatments 4 and 2 are assigned the letter B. The next range includes treatments 2 and 3, so that's assigned C. There are no more means without a letter, so we are finished. The letters are typically reported to the right of the means. And so that's how we'll typically see that in the AOV report. And that'll be kind of our last session here, the 4th in our series, where we'll talk about generating this AOV analysis, go through some common options that people use, or you would want to consider as you're configuring that report, and then we'll also we'll just do a basic here's what the report looks like as well. That will be all in the AOV analysis session. All right. So in summary, the AOV analysis breaks apart the variance of observations into different sources, and then calculates a p-value probability. Then we perform a mean comparison test to determine which treatment mean differences are significant. But we need to be cautious with this analysis, because if the data does not fit the assumptions, we cannot rely on the results. Therefore, the steps like data confirmation and data review are important prior to running the analysis and reporting your results. And we'll go through each of those steps in the upcoming webinars. All right, as promised, I was somewhat short-winded this time relative to most of ours. That's the end of my presentation here. If there are any questions, certainly have time to tackle those. Otherwise, I appreciate your participation, and hopefully we'll be seeing you here in the next few sessions as well, as they're all kind of linked, of course. Great. Well, I won't want to keep anyone longer than they have to. I'll hang on the line for just another minute if you are typing a question. But in general, thanks for the great participation. A great list of those joined live, and of course, like we said, we'll send out the recording for anybody who couldn't attend live. We'll get that out there here later today. So thanks, everybody.
Thank you, Matt.
Yep. Thank you.
Thank you. Bye.
Thanks.
Thank you. Bye.
Thank
Thank you. Have a good
Bye.
afternoon. Bye.
Bye-bye.
Thank you. Bye.
Thanks a lot.
Bye.
Thank you. Bye.
Thanks, Matt. Bye.